Hello, Mr. Abidin. What are the most common urological cancers we see in urology? What symptoms do they present with? Does early diagnosis really save lives? Could you explain a bit?
The most common types of cancer we see in urology are bladder cancer, prostate cancer, and kidney cancers. If a cancer is diagnosed early, we have the chance to be curative to save the patient's life. You asked, what are the symptoms we encounter? The most common symptom we encounter in bladder cancer is painless bleeding. Therefore, our patients need to pay attention to the color of their urine while urinating, and the frequency of cancer increases with age. And bleeding seen by our patients in urine, painful, clotted bleeding can be a warning for bladder cancer. Secondly, in kidney cancers, bleeding is also a symptom. However, in kidney cancers, painful, clotted bleeding is more frequently encountered. However, kidney cancers have a distinction. They may not show symptoms unless they reach very large sizes. Therefore, it is a cancer that we detect incidentally during routine ultrasounds, meaning while investigating for different reasons. When we catch kidney cancers at a small size, we can perform treatment and surgery while preserving the kidney. In prostate cancers, symptoms often may not appear. In benign prostate enlargements, our patients usually experience some difficulties and obstructions in urination, whereas prostate cancer may not present any symptoms. So, what do? Starting at the age of 50, routine prostate monitoring is necessary. Even if you have no complaints or symptoms, we need to conduct prostate screening. PSA is very important for this diagnosis, and physical examination is very important. That's why screening for prostate cancer needs to be done every year.
Hello, Mr. Gürdal. Is erectile dysfunction one of the issues men are most concerned about, age-related, or can it also be seen in young people? How do you treat it?
Yes, actually, it is possible to say that erectile dysfunction can be seen at any age where there is sexual activity, and its frequency increases with age. In the treatment of these patients, it is necessary to first evaluate the patient and, if there is an underlying cause, to find and treat it. But if we cannot find an underlying organic cause, we first apply some behavioral therapies, followed by some medical treatments aimed at increasing blood flow to the penis, and then regenerative treatments to restore the lost functions of those tissues. As a last option for patients who do not benefit from these, we have some permanent lifelong surgical treatments.
How advanced are surgical techniques today? Are there more comfortable methods instead of open surgery?
Of course, with the advancement of technology today, many of our surgical techniques have also progressed further. In the past, the recovery time for surgeries we performed openly was longer. The time for the patient to return to social life was extended. Nowadays, we perform many surgeries using laparoscopic and more advanced technology, such as robotic surgeries. In our hospital, with laparoscopic and robotic surgeries, patients' hospital stays are shortened, they recover and heal faster, and they return to their families and social lives more quickly. Of course, if we ask what are the effects on surgery with robotic surgery, especially in oncological surgeries, we have a higher chance of cure. We have a better chance of preserving the patient's tissue surgically, and it is a process where recovery is greatly accelerated for the patient. Therefore, our preference is always for the innovations brought by technology.